Hello and welcome back to Get It Off Your Chest, a What I Wish I Knew guide from girlfriends who have lived, fought, and survived breast cancer. My name is Andy, and I am proud to be the host of this amazing group of women. For this two-part podcast, we will be tackling the subject of mental health, both during treatment and as a survivor. Joining Corey, Amber, and I for these two episodes are Tammy Helgett, Andrea Meyer, Sarah Schultz, and Bonnie Fortwengler. Throughout this first episode, we will discuss the mental toll that breast cancer takes on a patient going through their diagnosis and treatment. We will hear from Bonnie about her perspective as a mental health expert, as well as Corey's side of being the physician who gives a life-changing diagnosis. With that, let's get started.
My name is Sarah Schultz. I am currently 34. Yes, my son will remind me of that. I was diagnosed November 14th of 2019. Great day. Not. But I had Dr. Corey Jordan to help me with that. My last day of chemotherapy was May 27th of 2020. So I am 2 years out.
Nice.
Cool. My name is Andrea Meyer. I got diagnosed with breast cancer in January 2020. And tomorrow is actually my 2-year anniversary from my last chemo treatment. So
Yay.
awesome. Yeah.
I'm Bonnie Merrick Fortwengler. I am from Meraki Legacy Counseling Services. I've been working in healthcare as a mental health therapist for over 20 years.
Awesome.
I am Tammy Helgett. I was diagnosed in November of 2021, and I finished chemo on May 23rd, and I have surgery scheduled for Monday, June 13th, so next week.
All right.
13.
Yes, there we go. All right, so some questions for you guys since it's about mental health. I think my first one I'm going to start with is who was kind of your biggest supporter, and how did they make you feel loved and supported? But kind of before that, actually, what did it feel like going into that diagnosis and going into treatment? Like, what happened, and how were you guys feeling?
I cried a lot. Overwhelmed. But once I finally started meeting with Dr. Jordan and all the other people that would be involved in my care, and we had a game plan, I felt so much more relaxed. Like I just knew all the steps we would have to do, and that was super helpful.
Sure.
It was hard, I think the first thing I was asked was, where do you want to be treated? I have no idea. I don't know what to do here. You just get this diagnosis and your head is spinning and you're supposed to make some major decisions right away. And I reached out to a friend who I knew was going through the same thing, and just those early days of not knowing, and you just want something done now. You want treatment to start, you want surgery, you want something, and it's a longer plan. You have to get through all the testing and things like that. That was difficult. A lot of tears, until you could focus on something. I can focus on my MRI. I could focus on, whatever. So it's.
And I don't know if my diagnosis broke me, but I maybe shed a few tears here and there. My husband was with me when I got diagnosed, and he broke. He took it harder than I think I did. I remember that day I ran upstairs, talked to a coworker who also had breast cancer. She told me to take the day. She would take care of everything else for me. I went home, called my mom. My mom's my best friend, and that's when I cried for the first time. I was like, this is what's going on. I'm going to be okay. I'm going to fight it. And I hopped in the semi with my husband, and we hauled a load of beans. And we just talked and decided, we're going to get through it, because Dr. Jordan and Chrissy, after they left us with you have invasive ductal carcinoma, they left me and my husband sit in that room, and it was like, I was trying to console my husband, oh my gosh, I'm going to have all these appointments, who's going to do that? I have a 3-year-old, I have a 1-year-old, how is this all going to work out? But they came back in, and everything was set up for me. They will call you, Sarah, I will call you, I will take care of that. It was literally, you just go deal with it and how you see fit, and that's what I did.
And I think to Sarah's point, saying, consoling other people, I've spoke about this before too, but that's what I remember 7 years out now in my survivorship. But I remember, as you tell people, and you just have to break the hearts of all of your friends and family and see that horror on their face, and your instant reaction is to console them and put on your fighting face. And yes, a lot of tears were shed, but I just remember that time being that a lot of that too, trying to help your family and friends and our children understand what's going on and not feel scared, and really be able to comprehend it and feel okay about it too. But I also remember, I think all of us had, people that, t-shirts were made, and
Right.
a lot of community support that we get in these small towns in rural Minnesota, and that was awesome. And I think, so you have all of that support right away, and all of these people really rallying around you, and social media and all of that, so that you kind of do put that fight or flight face on, and you're just ready to get going and battle it and be done, So that's what I remember.
I think it's just an interesting concept of who's going to carry the burden of the diagnosis, right? Oftentimes it's the patient that we give it to, but then who takes it from there? And it's usually, our patients are usually the mothers of the family, the matriarch, the ones that's holding everything together. And so it's very common that they'll try and hold on to that burden of the diagnosis and not try and share it with spouses or children or things like that. And then it becomes really kind of onerous and not so good at self-preservation when you're carrying that burden.
That's why we're here talking about this today.
Yeah. And speaking of somebody carrying the burden, I think my son took the news the hardest. He couldn't sleep, and one night I was snuggling with him in bed, and he said, "Mom, I feel like hurting myself." Yeah. And was he using the right words to explain how he was feeling? But we seriously took all the guns and knives out of our house and got him to Bonnie ASAP.
How old is he?
He's 13 now.
Mm-hmm.
But
So he was 11 or so back
Yep.
then?
Yeah.
And Bonnie, how do you go about talking to these patients and their family members as well?
I think a lot of it is just normalizing and giving them some space to talk about whatever they need to talk about, and so that they're not worrying about their loved ones feeling, that I can contain some of that in the space that we give them, and just giving them an outlet of whatever needs to be talked about. I think that that's so important, that a lot of our mental health care needs to be a wraparound approach, that it's certainly, you're the person that has the cancer, but all the other people in your life are also being affected by that, and just having somebody to be able to process and just to have space, I think, more than anything, is really therapeutic, no matter where you are in your journey.
I think that's a great concept. I often tell people that cancer is a trauma that impacts the entire family, and there's just collateral damage that happens all around. And trying to be cognizant of that trauma has happened to everybody, not just the one person having the cancer experience. It's really shared by everybody else.
I would agree, and saying, creating that bubble or whatever, their outlet for getting it off their chest. I don't know about anybody else, but I come from a huge family. So you have 120 family members who are how are you doing? What's next? What's going on? I blogged about it, and that was a huge, if you want to know what's going on, read my blog, because I am busy taking care of myself, my family, making sure I'm getting to all my appointments. That was my outlet. That was my jam. I'm not going to answer every single text message. I'm not going to answer every single phone call. Here it is. Read about it. And if you want to bring me a meal.
I like that. Did anyone else have something like that you guys kind of used as an outlet, as something to make that space?
I did Caring Bridge. It's
Okay.
kind of the same.
Yeah.
Kind of blogged on there.
A lot of group text messages. It's like my siblings, my friends, my in-laws. You just kind of compartmentalize them. And I know, it's different with the young kids. Do they understand things? Well, my kids are adults, And I kind of felt that in the beginning, that I had to shield them from it a little bit and not scare them, even though I was scared. But it's easier now, once you get into the treatment and you have a plan and you keep going, to be able to be honest and open with them and have their support. They've been wonderful. We've been through a crisis in our family before and have done family therapy, and we really learned a lot at that time. And this has been good to be open and just share.
Would any of you say that there was anything that would make it maybe more difficult? I know you said you have a big family, and it would just be kind of annoying if all of them are texting you, and it's just like I need you to back up. This is not helping. Is there anything that would kind of make something worse, even if it was like well meant or it had good intentions behind it?
Like I said before, I don't know if cancer broke me or what happened, but I kind of became, I understand everyone has a story and everyone goes through trials, tribulations, etc. But at some point you just got to put your big girl pants on and you got to do it. So seeing people's Facebook posts being like, I'm so tired today. Does anybody else have days where they wake up and they're just so tired? I literally had to cut myself out of that. And even with some of my extended family members being like, oh, so-and-so is doing this. Well, that's so good. And I'm so thankful that everyone else, that we're fortunate enough to have to go to the doctor and get a colonoscopy or skin checks, different things like that. But I stopped having the pity party for everybody else and myself, because the only person who was going to be accountable for myself and how I got through it was me. And I feel like a lot of people who maybe struggle, and I feel like I've said this to other people too, at some point, we just need to say, all right, I'm drawing a line in the sand, and on that side is going to be the me who is just going to do it. I'm not going to sit here and cry about it and kick and scream. Sure, I may want to, but we just got to do it. And sometimes it came down to relationships where it's like, I really appreciate your care and concern, but I also can't be babying you because you're crying over what I'm going through. I'm just gonna do it. I pulled up my pants already. It's time for you to pull up yours, and let's just cinch the belt and let's go and get it done.
I know you've talked about that too, where you say, I want to help people so that they don't feel bad about this, and then you kind of have to, go back and say, wait, this is kind of backwards, and I'm sure a lot of you have felt that way too. But yeah.
I think of two things when you say that about people with good intentions. Now, again, 7 years later, when people ask me how to help other people going through breast cancer, I always say, treat them the way you did before they had the diagnosis. Because I'm the same person I am today, or whatever, post June 15th of 2015. I'm the same person I was on June 14th. So don't talk to me differently. Don't treat me with pity. And I know they're good intentions, but it makes you feel so not good. I didn't like that, which is what we talked about last week with the wig and the don't look at me that way. And but the other thing I can think about would be the color pink. We've talked about the pink washing, and so a friend reached out to me this week and said, my sister-in-law is having a double mastectomy coming up. What can I give her for a care package or whatever? And I get that question all the time. I don't know if you guys do too. And I said, so I sent her my favorite recommendation, which was a robe that one of my friends from Omaha sent me. And I still wear it to this day, and it feels like just wrapping up in a hug, and it's one of my favorite things. And so I had recommended that, and I said, and do not get her the pink one. I said, breast cancer survivor, people will flood you with pink everything. And I know we're sitting in a pink office right now, but I did get over some of my hate for the color pink. But anyway, so everybody assumes you love pink, and everything should be pink in your life all of a sudden, even though you don't have anything pink before. That's not the and that maybe just have been a personal thing. But I think it was more to the point of that, you know, that just defines you as a breast cancer patient, which is fine, you are, but treat people the same way that they did before. So that was kind of something that a couple little takeaways I had.
It is interesting the way people react, you know, and, you know, right now I'm still wearing head coverings, and I had one person come up to me and just say, so have you had surgery lately, or, you know, what's going on with you? Just very upfront about it. And other people just kind of look at you and completely ignore it, you know, and you know they don't know or are afraid to ask. And, you know, I have my brother doesn't want to talk to me about it because he'll find out the information some way else, but he doesn't want me to have to talk about it again. You know, so everybody else has a different mindset about it too, and you have to respect where they are. You know, I'm not going to force anybody to talk about it or get into the nitty-gritty of it, you know, if they're not comfortable with it. And some are wonderful, you know, come right up to you, and you know, and it's great. The support is wonderful.
We should do a whole podcast on things people say to you.
Oh my
Sure,
gosh,
there's a
I
lot.
can tell you just a really quick funny. My son was 3 after I shaved my head, and I came out of the shower and he goes, "It's not growing yet." Thinking the water would like sprout new growth.
Like a chia pet.
Yeah.
Oh my goodness.
I had an elderly lady say to me when I told her I was going to start treatment for breast cancer, she said to me, I was 40, mind you, at the time, well, we all have to die of something.
Oh my gosh.
You can imagine my reaction to that. I was just stunned into silence, which doesn't happen very often.
Maybe that was her intention, just like a quick slap.
And talk about it years later.
Word. As I'm listening about the conversation in this room, and I think about the conversations that sometimes that we have in a session with somebody about who is going to be your bodyguard, who are going to be your protectors, and all of you women are that are survivors, you are doing that role for women that are currently in treatment by saying, don't do the pink, or please don't say that, or acknowledge it. And I think that that's so important because as you're in active treatment, you don't have the energy to do all those things for yourself. But who in your family, or who are your friends, who's your tribe that can help manage those people that are like a little overbearing, or they're maybe they're too intrusive, or they have really good intentions, but it's not the right time. And so who are your tribe? Who is your bodyguards? And that's what I hear you guys are doing for each other as there's new people being diagnosed and needing that, and you're identifying like, hey, don't do the pink, or hey, you know, let's just acknowledge what's going on in the room, because that's sometimes a whole lot easier than pretending it isn't in the room.
I love that concept. Who are your bodyguards? I'm going to ask my patients that when they come and see me.
I actually have a coworker who's going through breast cancer right now too, and the fact that I've been through it, I checked in with her every chemo day because I appreciated somebody I wasn't all that close to. She was some lady that worked at the eye clinic. She would text me every Wednesday of chemo and say good luck today. So I did that for her. My last day of chemo, she showed up and was standing outside the clinic with balloons and a gift, and I just remember, I'll never forget it, how shocked I was. Her last day of chemo, my coworker, I was outside the clinic waiting for her with a homemade crocheted blanket and flowers, and just because I remember how it made me feel, that just special that somebody took the time to celebrate that last day.
And sometimes it's the people you don't think are going to be that bodyguard for you that step up, and it just really touches your heart, you know, to have those people. It's like, wow, you are wonderful. The check-ins for chemo, that, you know, how are you feeling now? You know, what do you need? What can I bring you? You know, a meal, this or that, you know, and it's fabulous. Yeah.
Kind of trickling off of this conversation that we're already having, you know, I know COVID is going to be like a discussion we talk about later and how that impacted your treatment, but to be told you have a life-changing diagnosis, you start going through surgery, chemo, whatever you did first. I was able to bring my husband, my mother, and then at my last Red Devil Day, I walked the red carpet with some friends. We popped some bubbly. But after all that happened, it was completely shut down. And you couldn't bring anybody. And I just remember it's kind of like a blessing in disguise. But I became so close with everybody in my chemo group. I mean, I won't name names, but there's so many great people that I think about on a regular basis, or when you open the newspaper and you see an obituary for somebody that was in your chemo group, or my uncle got to join me for one of my chemotherapy sessions. You just develop this huge bond where it's like, I was telling Andrea the other day, I was at the medical center and I was waiting for a lab trial. I was like, oh, swear to goodness, I just heard him walk by. So I shot him a text. I'm like, either I'm losing it or you are in this building. And he shot me a text back. He was like, yeah, I'm over in radiology. I'm like, so you did walk by. Well, where are you? And anyways, it's just crazy how you look forward to those chemotherapy days, because those are the people who understand what you're going through, and they're the only people that you could actually talk to during that time, because you couldn't bring anybody with you. So your bodyguards technically got condensed during that time, because this is who you're stuck with, or the chair you're stuck in, whatever it may be. And it was just kind of nice to build those stronger, greater relationships. Sadly, there's some people we wish we could shoot a text message and say hi to, but we just never thought, like, I love hanging out with you, I like chatting with you, but I never got your phone number. Like, or those people, yeah, it's just those bodyguards. They changed drastically when COVID started, or I should say, like, your inner circle changed.
I agree, and it sounds kind of crazy, but I was in the same, basically one treatment behind Sarah, and I was excited to go every week and see her and laugh with her and some of the other people in our group, and it was just super helpful to have those people to bond with and laugh with and tell silly jokes, and it was, yeah, chemo sucks, but
Well, there's a lot of blessings that come out of this horrible diagnosis, and my chemo buddy Shiloh and I, we used to say thank you cancer. We still use that as a hashtag a lot of times, because there is a lot of, blessings that do come, friendships that would never have happened. And
like Sarah and I.
Exactly.
I think we connected day one. Mm-hmm. They put me in that green chair. It's ones that's kind of in the middle so that everybody can see if you're going to pass out or get sick.
And literally the week before she showed up, somebody did pass out. And we gave her crap. We're like, oh, that's the cursed chair. He's okay. And he was part of our, like, give each other crap group. Mm-hmm. But he did.
You hazed him for passing out at his
Yeah.
It's a tough crowd.
Tough crowd.
But I remember sitting in that green chair, and Sarah's in the corner, and she's like, what you in for?
Doing time.
Yeah. But yeah, that very first chemo treatment, became friends on Facebook, and I got her cell phone number, and we still to this day don't see each other as much, but we still text and talk. And
you keep forgetting, I saw you in radiology. I filled out that same form that you were filling out for your ultrasound, and on the form, you have to say what breast you feel the lump in. And so when you're looking at it as a nurse, you're taught right, left, because that's how it is on paper. But when you're looking at it as a non-clinical person, you're like, oh, so is that one? Which one do I put it down as? And anyways, I heard this woman across nudge John, now that I know him, like, so what side do I put? And I just wanted to be like, just put an R over one side and an L over the other. But I, like, kept my mouth shut, because I was like, I don't want to be intrusive. But I'm like, I bet you that's what she's in for. And sure enough, saw you a month later. Anyways.
So chemo groups, it's big. It's a big supporting group. Do you think that would have changed if it wasn't COVID times? Or, I mean, Amber, you could probably talk to this. Is that any different from what you experience?
Well, yes and no. Having treatment in a non-COVID time, I had somebody with me at every treatment. My husband came to every treatment, but again, I had met Shiloh, so we had our treatment on the same days, and the same group of people that were in there for different, different treatments, but we all got to be buddies on our Tuesdays chemo day. And so you have your group within, but I was also able to have my tribe from outside come, and we had like a theme every week and a party every week and cupcakes and lots of fun. And I worked inside the hospital at the time, so knew a lot of people inside the hospital that would pop down to visit. So when COVID hit and I saw these people going through treatment and not able to have those people, I just thought, wow, that has to be so different. I can't even imagine just not even being able to have my husband with me at every treatment. That would have been really challenging. So, and on the flip side, you guys were forced to bond with the people that were in the other chemo chairs too. So, I think probably pros and cons to both, but that's certainly an extra layer to your treatment and the mental health part of going through chemotherapy and stuff, to not have been able to have that family support with you.
I was fortunate. My husband was able to come to my first treatment, and then right after that it was shut down to visitors again. So then I was on my own and had my people, and then it opened up again, and my daughter came, and she just wanted to see. She just wanted to see what I went through, and she was glad she went. And it was kind of like when you're in the private room again, you kind of miss your tribe that's out there, and you get used to these people. I made the mistake in the beginning of sitting in somebody's chair.
Never did that again.
Never did that again. And then when I went in just for labs and things, I walked in there and somebody was sitting in my chair.
How dare they?
It was, all right.
I didn't realize there was a hierarchy in the chemo room.
Oh, there is.
Oh.
Yeah.
Mm-hmm. Mm-hmm.
Don't mess
Orange
with
is
it.
the new black.
Cancer center.
Please tell me you didn't sit in the green chair.
No.
Okay, good.
No.
Bonnie and Corey, how did you guys see care change, once COVID hit and everything just kind of got shut down? How did that change for you guys?
COVID is the worst thing that ever happened to cancer. I mean, in my opinion, it was just terrible, because I struggle as a provider to give enough information, meeting my patients where they are with this horrible traumatic diagnosis, and empower them enough to make a decision that they have to stick with for the rest of their lives in a 45-minute to a 1-hour visit, and then weed through all the trauma and the emotion and the haze and let them know that they're going to be okay. And then they've done studies on the conversations that I have with patients during that visit, and they absorb maybe 20% of the information that I give them, and of that, only half of it is accurate, right? So there's not a whole lot of fact accumulation during that visit. So another set of ears is really helpful. Well, we went through a period of time where another set of ears was not going to be available, so now it's me interfacing with someone who is in an acute state of trauma trying to make some very important decision, and I can't imagine how debilitating and isolating that is, and then going through treatment alone. So the hospital eventually loosened up some of the restrictions to allow one family member to come back, which was nice, but that's just not enough.
I think some of the challenges that a lot of the patients probably had is that their need to connect with others during treatment, and at the time of COVID we were told to stay within our parameters of our household, and when you're living and being treated for a life-threatening illness, there's this piece to the puzzle of how important to have some normalcy in your life. Go out with friends, go places, do things, and that was absolutely not what could have happened. And so, we saw that anxiety and some of the depressed mood and the isolation set in much sooner than we would have seen it pre-COVID. And so we had to find other outlets so that people could feel connected. Thank goodness for Zoom calls and just other avenues so that people could have some kind of connections. I myself did a lot of telehealth visits or phone calls, and at some point I said, I'm coming in even if I have to go now. because there were some people that just didn't have any family support from the beginning, and so like having to build into some kind of support was really important, even if it was a provider of some abilities to be able to have that connection. But I would agree, COVID has changed many different places, especially when it comes to cancer, because we still don't see a lot of support groups yet in person, and there's a definitely a benefit from in-person cancer support groups and doing exactly what's happening in this room, that sharing and supporting, even if it's just a head nod or be like, oh gosh, yeah, I've been there. And so I am optimistic that we can get back to some of those things, because it really does create a healing space when you can put a room full of people, despite what diagnosis they have. When you have cancer, there's that shared space that's really invaluable, that I can't provide, but people that are going through treatment provide for each other.
Yeah, absolutely. It's a different story for every person, but it's a shared trauma that they can all talk through. And while you're speaking, another thing came to mind is that anyone who knows me knows I'm a very touchy, not in a creepy way, person, but like trying to connect with my patients and show empathy, and just sometimes just a little, someone holding your hand as you're receiving bad news is really helpful in processing that. And, you know, post-COVID, we're gowned, we're gloved, we're masked, we're not supposed to touch anybody. And so that I threw by the wayside, but that was really hard for me.
Helping somebody self-regulate because you can sit really close to them during COVID was a really difficult challenge, because we're supposed to stay so far away, and we help people regulate all the time by the face we have, by our body language, and when you can't see half of it, it is very difficult to be able to do that. And so I can really relate to that when you're in a profession, when you want to hug people or you want to offer some support and you can't because you're afraid to like make them sicker than they already are, and it just felt so unnatural to a healing environment.
Yeah, absolutely.
So find your bodyguards. COVID sucks. We need more support groups. I think that will conclude our discussion of mental health during treatment. We hope you took something valuable out of these really great perspectives. Thank you for listening, and join us for part 2, where we go into the mental health of survivors and see what it's like trying to go back to normal after living with a life-changing disease.